Hello and welcome. My name is Dr. Nancy Collins. I'm a wound care certified registered dietitian and a member of the board of directors of the American Professional Wound Care Association. I'm thrilled today to have the opportunity to speak with the authors of a new article entitled Arginine, What You Need to Know for Pressure Injury Healing. You know, our understanding of the nutritional aspects of wound healing has expanded immensely over the past 5, 10 years, and it's a very exciting time in the area of nutritional science. We have a considerable amount of new evidence, and that's led even to new products and new standards. So I'm really happy today that we're going to delve into arginine with the authors. So it's my pleasure to introduce Andy Chu and Dr. Barbara Delmore of NYU Langone Health. And congratulations on a wonderful article. So let's get started and dig a little bit into this. What prompted your interest in arginine?
Dr. Collins, thank you for having us. I have always been fascinated by the wound healing properties of arginine, and arginine is such a powerful amino acid that is important in both immune health and wound healing. And since the latest EPUAP, NPIAP, PPPIA guideline came out in 2019, arginine is one of the hottest nutrients in wound healing again.
And I would like to echo what Andy said. You know, this has been a long time coming. Arginine has been around for a while. Even in our own place, it took a long time for a lot of the people, clinicians, to embrace it. One of the earlier groups that embraced it was the vascular surgeons. So this is a great time for wound healing.
Yes, it certainly is. So maybe some people don't even know why is arginine so important? Maybe you can tell us what makes it so important in wound healing. I know your article gets into it in a more complex nature, but why is arginine so hot?
Well, let us take it from the context of pressure injury healing, with the understanding that arginine supplementation is good for all wound healing. So in our article, we do talk about pressure injuries being a type of chronic wound. And because they're a chronic wound, what does that mean? That means stalled healing. Well, why is it stalled? There's a dysfunction between the intrinsic and extrinsic factors. And those intrinsic, extrinsic factors may be modifiable or non-modifiable. Either way, they're dysfunction. Now, in tandem, there's also dysfunction in the process between arginine and its complement nitrous oxide in this situation. And simply put, with this dysfunction in these processes, you simply do not get collagen synthesis. And when you do not get collagen synthesis, unfortunately, you do not get pressure injury healing.
And on the molecular level, arginine is made up of 32% of nitrogen compared to other amino acids with an average of only 16% nitrogen. Those extra nitrogen that helps with creating a positive nitrogen balance environment for wound healing. And arginine is also enhances the release of growth hormones that promote cell growth. And also it is a precursor to nitric oxide, prolines, and polyamines, which are all essential for wound healing.
Well, it sounds like arginine really has a lot of big roles, so it's really great that a nutritional factor is really getting its due and its role in the wound healing process. So, Andy, you mentioned before the new NPIAP guidelines, which were released in October, or well, I guess November of 2019. Can you expand on that? What is the new recommendation?
So, the latest 2019 international guideline dramatically changed the practice of wound healing nutrition in the field. It expanded the recommendations of arginine supplementation to adults with stage 2 or greater pressure injuries who are also malnourished or at risk of malnutrition. It is different than the older version of the guideline that arginine was used to be reserved for stage 3 or stage 4 pressure injuries only.
And Nancy, you bring up a good point. You know, for those who may have not seen that the specific chapter in the 2019 guideline on the new nutrition recommendations for, in this case, pressure injury healing or in treatment, I really recommend that our viewers check it out. It is quite a chapter. There was a lot of work that went into this particular chapter of the 2019 International Guideline.
Right. Now, I believe there's 15 points and recommendations and good practice statements that relate to nutrition alone. So this is just one of them. But Dr. Delmore, one of the most fascinating things when I was reading your article had to do with the cost, because, you know, certainly a lot of times people tell me, oh, nutrition supplements and things like that are very costly and we don't want to do it because, you know, it's just costing too much money. But maybe there's another way to look at this. Maybe we need to look at the total cost of wounds. So can you share what you found and what's included in your article on that point?
Well, we actually do share some experiences from other facilities, much in the guides of research, but I would like to give the viewers a little practical point as it hits in our facilities, because this is such a huge issue that we all face, right? How do we get something we really need for our patient population to improve outcomes, in this case, pressure injury healing, that does have a price tag on it. So in our particular case, we have a nutrition committee. And this committee is comprised of registered dietitians, pharmacists, physicians, wound ostomy care nurses like myself, and other nurses who have different specialties. And this group convenes to sort of talk about these type of issues. And the people who sponsor it, maybe it's one or two, maybe a mix of a pharmacist and a nutrition and someone like myself, a WOC nurse, we bring forth to the committee the latest research, the latest evidence. And of course, this is where the 2019 International Guideline helps you in these facilities. And depending where you are, maybe you're also sort of checking out what your colleagues are doing in the hospital or the facilities near you. And we also bring the cost. And in this whole discussion, we start to say, okay, what kind of problem do we have with pressure injuries and healing? Which particular population or clinical units? And so this really great discussion is how we justify many times bringing in something with a price tag such as arginine supplementation.
So when we look at the research, Saritas and colleagues look into the cost effectiveness of arginine supplement in a randomized controlled trial. And we found that although the arginine supplemented group was significantly more costly, but there was a larger significant reduction in non-nutritional treatment expenses, such as nursing labor and dressing materials. At the end of the day, the total cost of pressure injury treatment in the experimental group with arginine was significantly lower than the control group, which ended up to a total saving of €74 per patient, which is approximately $87. It is a money-saving approach.
Right. Yeah. So that's really a great point. You may be putting out a little bit more money, but what are you saving on the other end? And that can be obviously very, very much savings. So that's really great. You know, another thing that people always tell me is that, oh, well, in acute care, we don't really have to do anything. They're only going to be there a few days. The wound isn't going to heal in 3 days. What do we tell those people who think, well, maybe they don't need the arginine started because they're going to be going to somewhere else on the healthcare continuum in just a few days?
So the length of stay in acute care tends to be short. However, wound healing is like running a marathon. It takes time. It may take weeks, months, even years for a wound to be completely healed. And in fact, it is recommended for patients to take these arginine supplemented oral nutritional supplements for at least 2 to 3 weeks to see any result.
And it speaks to also building relationships with other nursing facilities as our patients transition through care, right? And can they sort of support this care plan? And if they can't, what's the next best thing? So again, in order to really help our patients to the next continuum of care, because the reality is they're not in acute care for a long period of time, what can we do as facilities to help this bridge for better care for our patients?
Yes, well, hopefully you'll start it in acute care and then those orders will transfer to their next point and it will continue. So yes, certainly a good point. So Dr. Delmore, how do we put this information about arginine into practice? Do you recommend that places make a wound nutrition protocol or have standing orders, or what do they do next to make sure that every patient has sufficient arginine on board for healing?
Well, that's a great thing. And I know Andy's going to echo me on this, but that same nutrition committee that I was speaking about, those are the people, once they decide what to bring in the house, they're the ones that also create any kind of protocol or algorithm. Because let's face it, especially in any facility, it's a 24/7, right? And so what does the clinician do at 3 o'clock in the morning or 5 o'clock in the morning, 6, whatever, when, the people who have that knowledge are around? Well, it's to create a protocol. And then, of course, once you create a protocol, you have to educate all the necessary team members.
And it takes a multidisciplinary approach and support for a wound healing protocol. Clinicians can use this article to develop logarithm, decision tree, on what kind of patient population should be receiving these arginine supplementation for optimal wound healing based on the organization's need.
So it sounds like, okay, so we know now arginine is important, it's incorporated in the guidelines, so then everyone should read the article and then on some protocols and some team building and get nutrition really out there in the forefront. Do you guys have anything to add before we end this interview?
No, I think we about I think
Okay.
everybody understands we're very passionate about pressure injuries.
That's great. And it's great that we're including nutrition now also. So that's about all the time we have today. I want to thank you both so much for taking this time to speak to me about your new article. I would encourage everyone to read it in the December issue of Advances in Skin and Wound Care, and everyone to recognize that nutrition is a critical piece of the wound healing puzzle. And now it's finally coming into its own. Very exciting times here. And make sure that you include a registered dietitian on your wound healing team. So thank you so much for joining us today, and we look forward to having further discussions on the topic of nutrition and wound healing.
Thank you, Dr. Collins.
Thank you so much.
Thank you, Dr. Collins.